Good morning, everybody. Christine Marconi here in the NBC4i Streaming Center, joined by Dr. Joseph Gastaldo from Ohio Health, infectious disease expert. And we wanted to bring him on for a couple reasons today. There's new developments in the COVID-19 vaccine world. You may have seen yesterday a new vaccine called Novavax just got FDA, I believe it was board recommendation or the advisors. Can you actually explain a little bit more about this? Because I know it's using some technology that we're more familiar with as far as vaccines go.
Well, first of all, Christine, thanks for having me. It's great seeing you again. So, right now in our country, we have three FDA authorized vaccines. Actually, two of them are fully FDA approved for the primary series. And the mRNA vaccines made by Pfizer and Moderna are officially the preferred vaccines. So, we now have the pathway to have a new type of vaccine available made by Novavax. Novavax, I think, has long been forgotten. It was one of the vaccines supported by Operation Warp Speed. And there are people who, for whatever reasons, mostly because of misinformation, are fearful of mRNA vaccines. So the Novavax vaccine is a more traditional vaccine. Remember, we want your body to have safety against this virus by having exposure to the spike protein. And with mRNA vaccines and the J&J vaccine, you're actually teaching your own cells to make the spike protein. The Novavax vaccine is a more traditional vaccine, and the spike protein is actually made in the lab. They actually make the spike protein not from the virus, but they do it through insect cells, cells from moths. They actually have the technology to make the spike protein. So they collect the spike protein in the lab, and then they use what we call an immune adjuvant or an immune booster. And immune adjuvants we have used in many other vaccines, like for hepatitis B and for the new shingles vaccine. And in the clinical trial, the Novavax vaccine prevented COVID-19 in roughly 90% of participants. And the study was roughly 25,000 people, and it took place both in the United States and North America. In the clinical trial that's been published, the vaccine, when you compare it to Pfizer and Moderna's mRNA vaccines, had less reactogenicity, less of a really side effect profile. Also, in the Novavax vaccine, there were two volunteers who did have signals potentially with myocarditis, so that obviously needs to be looked at and watched closely. But having that vaccine available, I think, is important for Americans because there are people, for many reasons, who are fearful or uncomfortable with mRNA vaccines, and having a more traditional vaccine, I think, is going to be a welcome option for many people in the community.
Yeah, I think the more people that are comfortable with getting vaccinated for whatever reason it is, the better for sure. Um, so we're about basically a year out exactly of when the vaccine was readily available to everybody, every age group. Um, and we're still right now in this area. Would you still consider it a slight uptick in the virus, or how are you feeling about what you're seeing here in the state of Ohio as far as COVID numbers are going and the country as well?
Yeah, so we both know in Ohio and nationally, there's more COVID out in the community. If you look at the weekly report now that comes out by the Ohio Department of Health, the numbers have gone up. And again, if you reflect on what those numbers are, they're actually PCR tests. They really don't necessarily include the home antigen test. So it's very much likely to be an underrepresentation. However, we are in a much better and different place than we were last year and the year before. We have vaccines, we have outpatient treatments, we have better messaging on the appropriateness of wearing high quality masks. And I think moving forward, having COVID and COVID discussion is going to be less disruptive on how we live our day-to-day lives. One of the words I use a lot from where we are now in the pandemic is what we say is decoupling. And unlike any other uptick or surge we've seen before, specifically Omicron and with Delta, even though in the community we are seeing more cases, we're not seeing the same rate of incline on hospitalizations. So if you look at the hospitalizations, specifically in Franklin County, they are essentially not going up to the same extent as you would expect with previous surges in the community.
And you attribute that to people being vaccinated as well as these different treatments that we have out there?
Yeah, that's a big part of it. If you look at where we are now, roughly 90% of people have had exposure to the spike protein, whether it be vaccines or having a previous infection. And, when we talk about immunity, it's very complicated. It's various shades of immunity. I want everybody to have protection from being hospitalized or dying. The vaccine working is if you are vaccinated and if you get COVID, you're home with a mild cold or flu. That's the vaccine working. And I want everybody to have that protection from severe disease resulting in hospitalization and death. And the safest way to do that is really a combination. Number one, being vaccinated, staying up to date on your vaccine. And number two, for anybody with an at-risk condition, regardless of your vaccination status, what is your plan to get the outpatient COVID-19 pills?
Um, want to ask you about something that came out today from Moderna. They're you described it as bivalent, the new word for me. Can we talk about this? And it is also good news on the vaccine front as well.
Yeah, so tentatively this fall, it's been both announced by Pfizer and Moderna that they're going to have hopefully the availability of the next generation of vaccines. Moderna had a press release that came out this morning. Again, what they talked about in the press release has not yet been published or peer reviewed, but nonetheless, it's a good thing to really talk about. But this fall, we'll likely have the next generation vaccine, bivalent vaccine. Bi means two. And what Pfizer and Moderna are working on is when you get your mRNA vaccine, there's going to be two different recipes to teach your cells how to make the spike protein. The first spike protein is going to be from the original strain that we've all been exposed to already, but also to an Omicron specific exposure will be in there. And in the press release today, it showed that the vaccine was safe and it provided really good neutralization activity against the Omicron variants.
What does that mean for your everyday layperson me? Does that mean I'm going to have to get, would it be considered a booster or a brand new vaccine like when I get my flu shot in the fall?
Well, in the context, I think of where we're going with COVID, we will likely have a general recommendation for everybody to get a regular vaccine. The flu shot is FDA approved and CDC recommended for everybody 6 months and older. And I think when it's all said and done, we're going to have some type of regular boosters for the COVID-19 vaccine. Now, we don't know if it's going to be annually. We don't know if it's going to be for people above a certain age or medical condition. So we still have to wait for the data on that. But I do think this fall there will likely be a more universal booster recommendation for everybody.
Okay. When do you anticipate this Novavax being available to the public?
Well, hopefully soon. So what we had approved yesterday was a subcommittee within the FDA. The FDA leadership still has to sign off on it. And one of the things they really have to figure out is to understand that Novavax has their manufacturing process up and running. That's the big reason why we have not had Novavax available yet in our country, because of manufacturing issues and raw material constraints. So that still needs to be figured out. The FDA leadership has to sign off on the subcommittee recommendation. And then after that, like any other vaccine, it has to go to the CDC's Vaccine Advisory Committee for the final recommendations. What the FDA subcommittee authorized yesterday was that the COVID vaccine be authorized for people who have not yet received the vaccine. So what I want to know is, can the Novavax vaccine be used as a booster? And if people who get the primary series of Novavax, what's their recommendation going to be for a booster? So again, we have to wait for the CDC to dive into that information so we can get recommendations out to everybody.
All right, Dr. Gastaldo, anything else that I may not have asked you that you would like to add?
No, I think, we're in a much different place than we were last year. By the end of June, all signals are pointing to the vaccine availability to all Americans down to the age of 6 months. That's positive news. We really want everybody to be on point with staying up to date on their vaccines. And that really means for everybody 5 and older, at least one booster.
Okay. All right, Dr. Gastaldo from Ohio Health. Thank you so much. As always, more information on everything we just talked about in the article below and on NBC4i.com, guys. Thanks so much. Bye.